man, I have so many places to go with this. But maybe just starting with, what are some of those guidelines?
Between 150 and 300 minutes of aerobic physical activity per week for adults, and 2 times per week for muscle strengthening exercise. So that's for adults. For kids.
Hello everyone, welcome to the Movement and Performance Podcast, where it is my goal to help people get active, connect with their body, and perform better. In this episode, we're joined by Dr. Laurie Whitsel, the National Vice President of Policy Research at the American Heart Association. In this episode, we'll explore why physical activity is essential for long-term health and how we can make it a sustainable part of our daily life. Without further ado, let's get right into it. Why physical activity? Why is it an important part in cardiovascular health?
Yeah, so I will take that up even up a level to say, we used to have Life Simple 7, and now we have Life's Essential 8. So when I get asked, how do you take advantage of how do you help improve your heart and brain health, I can really just talk about Life's Essential 8, and that is physical activity is one of those 8 essential things you can do to keep your heart and brain healthy. And we have the physical activity guidelines, which we'll talk about. And then there's also healthy eating, a healthy eating pattern of primarily whole foods and fruits, vegetables, lean protein, and whole grains, and then healthy oils. Then there is managing your weight and not using tobacco. And then we have the clinical factors, glucose, managing your glucose, cholesterol, hypertension or blood pressure, keeping it below 120/80. And then sleep is our new 8th factor that we've added to cardiovascular and brain health. So, getting adequate sleep for both adults and children is really important. But then physical activity itself is such an important part of our overall health and well-being. And, we often focus in on the physical aspects, the physical benefits of it, whether it's for cardiovascular health, chronic disease prevention, bone health, muscle, keeping our muscle strength over the course of our lives. But there's the mental health benefit as well for depression, anxiety. And then, the other factors of, improving self-esteem, reducing social isolation, and for kids, improving their academic performance, their classroom behavior, their focus, their ability to focus during the day. So there are all these additional benefits that make it this, wonder. I hate to call it a drug, but it's this. If you could bottle it as a drug, it would. Many people say it would be one of the best drugs we could give, but we can't do that. So I think one of our biggest challenges is how we motivate people to incorporate it into their daily lives. I think we can do that by surrounding people with the kind of environments that support active living, and then we role model it. And then just in our everyday conversation, just talk about the importance of making it an important part of your day. I think we can all own that, and we can all be advocates in that regard.
So your goal is to take the science, the research, and apply it to policy. So you would create, or you would be in the part of creating some guidance that would be given to whether it was the country or whether if there were local organizations that wanted to do a better job at this, they would look to your guidance probably to say, okay, well, what do they recommend? What do the experts recommend? So you're creating that guidance that would help support bringing this to life in the community.
That's right. So there is a National Physical Activity Plan, and that has been developed with experts in the field and working alongside government to do it. The National Physical Activity Plan is a roadmap for implementing the physical activity guidelines for Americans across 10 different sectors, including schools. Schools are an important sector, but we also have military, we have community, we have recreational spaces, workplaces. I help lead the business industry sector of the plan. And so that's a great roadmap. But what's really great, Anthony, is that all the public health organizations in the United States have coalesced around the federal physical activity guidelines for Americans. So that's our North Star. And, the physical activity guidelines were first released in 2008. and then 2018, a decade later, and we're due for another one in 2028. We're going to have to see if we can get that done. It's interesting because the dietary guidelines are mandated by Congress in statute to be done every 5 years. We don't have that mandate for the physical activity guidelines. So to this point, it's the Department of Health and Human Services that has decided to do these guidelines. And it's on a 10-year cycle versus 5, but they do a mid-course check-in. So over the last 2 guidelines, we had a mid-course check-in after the first guidelines that really focused in on kids, physical activity for kids. And then the second mid-course update focused on older adults. So, I think a 10-year cycle is actually very reasonable. That gives time for the science to change and for us to really look at the science and see how we need to change our guidance for the public. But, and we were starting to do a really significant review of what topics need to be covered in 2028. And that's been, those discussions have started, but we'll have to see in this administration how quickly or hopefully we do move forward with the next guidelines, because as we learned in that review, there are a lot of topics for us to check in on and we probably do an update on.
Man, I have so many places to go with this, but maybe just starting with, so people know, what are some of those guidelines? Like how often should people be moving and what are those components that they should hit? Yeah,
such a great question, so important. So and I would say that we're coalesced in the United States around those guidelines, but also around the world. So our Department of Health and Human Services coordinates with other countries globally, and we're all on the same page. So it's between 150 and 300 minutes of aerobic physical activity per week for adults, and 2 times per week for muscle strengthening exercise. So that's for adults. For kids, it varies a little bit by age. For young kids, we want to see them doing about 3 hours of play and movement throughout the course of the day, structured and unstructured. As we get into school-age kids, we're talking about 60 minutes a day. And the National Academies did a report several years ago, because I know you and I have talked about it, how many of those minutes should be in school. And the thing is that they spend so much time in school that probably a good part of those 60 minutes per day should be in school. And in addition to the 60 minutes of aerobic activity, kids also should be getting muscle strengthening exercise about 3 times a week, and also spending some time on flexibility and so forth. So building their bone strength. So we also like to stress with kids the importance of using their body weight to do things like running and jumping, because we have seen bone loss in kids, which is a little concerning. So exercise can be an important way for them to counteract that, and it's really important that they keep building their bone strength when they're young, because that starts to level off as they get older. And then when they start to lose, we get to our upper 20s and low 30s, and we start to lose our bone mass after that. So it's really important that you put as much in the bank as you can when you're young.
Yeah, I talk about something called a fitness retirement plan.
Oh, yeah.
And I think the sooner you start, right, just like any retirement plan, if you invest early, right, that compounds more and more. And with kids, another thing I usually say is they're kind of like wet concrete, easily moldable, whereas when you become an adult, you become solid concrete. And so those habits, it's such an important time to mold the habits and mold the body, because there will be tremendous carryover into adulthood. Some people, I think, say, I could just do that later. I don't have to worry about it now. But that's not really how the brain and body works. There's these investments, and then there's also these habits, and there's other things that are built from childhood that are so important to build at that age, I think.
Yeah, you're absolutely right. That's a great way to think about it. I'm going to have to borrow your your metaphor there, because I do feel like we have to make this investment in our kids. And we can talk about where the current focus is on kids in terms of chronic disease with this administration. I think it gives us some opportunity to put a spotlight on it. But I couldn't agree with you more. Healthy eating and exercise, starting, from really the time that they're born. I will say that we don't have specific physical activity guidelines for kids under the age of 2. That's kind of this next iteration. We'll probably go there a little bit more, but just the idea though that kids should be moving as much as possible and given the opportunity to move freely, from their time.
And yeah, you mentioned the piece on freely, and I noticed you also said play.
Yes.
So probably for the younger years, it might be a little more unstructured. It's still very similar, but it's a little more unstructured.
Yeah, sometimes, you can do organized play or supervised physical activity with the kids, but often it's, great just to see them play and have unstructured opportunity to move and do that. And so as a parent, I'm thinking as a parent, I could see, we did both with our kids, and I saw, it's in their preschool and so forth. It was both structured and unstructured, and as you say, probably more on the unstructured side, just free play. But sometimes kids need encouragement or some, just sometimes you can create fun games, and before you know it, they've moved for the last hour and had a great time and not even realized it.
Yeah, I think it's good to have some designated days, maybe where you're building out some skills, and then having the opportunity for play. And I don't know your thoughts, but I almost think even some adults can benefit from play. I know it's not a big talk, but yeah.
There's more. It's interesting because other countries do it more than we do, where there's opportunity for adults to play in sports or, recreational leagues and so forth. We have some of that for sure, but it seems to be greater emphasis in other countries. And I think that we miss that, if we don't give adults the opportunity to do free play. We've done it, at some conferences I've been to, there's been that opportunity for adults to play, and first people start out all a little bit shy and anxious about doing it, and before you know it, everybody's having fun and relaxed and having a great time, and it builds energy in the room.
Absolutely. Yeah, I think play requires some vulnerability, which it's a little hard for people to be vulnerable, but that's like the most exciting part of life, right? That's where you have your happiest and best moments. So I think that comes into a shift of like building it into culture, and that it's okay, and that might even drift into conversations of like the workplace, and I wonder what the stuff is you're doing there. But before we get there, just one or two other little pieces. Those 60 minutes, does it matter nowadays, moderate, vigorous activity? Is it just get 60 minutes of movement, or?
Yeah, it's moderate to vigorous. So that's a great point. And same with adult. It's 150 to 300 minutes of moderate to vigorous physical activity per week. So you can do mostly moderate, mostly vigorous, but generally it's a blend. And probably best to make it a blend because there are advantages to each. Moderate, for example, tends, there's probably more increased fat burning with moderate exercise, but better glucose management with your vigorous exercise. And, with vigorous exercise, you can do a workout in a shorter period of time. So efficiency is, an important part of a vigorous physical activity bout. And then maybe reduce risk of injury with moderate exercise, So for all kinds of reasons, I think it's good to do a blend. And so the guidelines say, some equivalent of that 150 to 300 minutes of moderate to vigorous. So 150 of moderate, 150 of vigorous, 300 of moderate, or some blend, equivalent blend. And I think that's generally how people do it anyway. And for kids, same thing. The vigorous activity, especially where they're using their body weight for running, jumping, etc., is a great way to build bone strength. So, it should be a combination for them as well.
I noticed a piece in the recommendations about there's no longer a 10-minute limit. Yeah, right, can you speak to that?
That was probably the most highlighted change in the 2018 physical activity guidelines. It was really cool. We had the chance to release those guidelines at our scientific sessions in Chicago. So we worked with the Department of Health and Human Services, and it was a wonderful opportunity to have the guidelines on our plenary stage, and there was great media coverage. And one of the key pieces that was highlighted was that we no longer had the minimum of a 10-minute bout to count toward your physical activity. And there were a number of reasons for that. First of all, the research was showing that any amount of physical activity is important towards your total for the week. And number two, if you look at the national surveillance systems and you took that requirement out, it really didn't change the percent of the population that was considered physically active. So that was also important. And it also makes it more accessible. You know, people realize that, and it fits kind of with how we go about our day. Like, you know, today I, did the stairs where I could, and just that short bout, though, it does count to my overall day of physical activity. So we want to, so I think the guidelines were really trying to meet people where they are and how they go about their day. But also the research is showing that any minutes that you can accumulate matter. And it also makes it seem like, oh, this is not so hard. If I do this in pieces, I can really get up to where I need to be.
Yeah, the way I look at it too, it almost, I think about physical activity is that it has to be a little more of a way of life. Yes. A lot of times we visit, like it's a vacation almost. You're visiting this thing and then you go back to what you usually do. But I don't think it can be that. I think it has to be just what you do. And if it is just what you do, that idea of do I take the stairs or do I take the elevator type of thing, you'll then choose the stairs. And what was her name? Mary Apetzo, I think was her name. But she, I think, coined the term exercise snacking. Or I don't know if that's been someone else that she got it from, but I think throughout the day, these little exercise snacks, that it's just a little here, a little there, a little here, a little there, a little here, is actually very, very helpful. And if you only consider the body, you might be also missing the mark on how that's impacting the brain.
Oh, for sure. Yeah. So I think exercise, as you say, exercise snacking is also good because there is a figure in the physical activity guidelines that I think is really helpful, and it shows the interrelationship between sitting too much and physical activity. So the more we sit, the more we've got to compensate with physical activity. So, sometimes if we can break up our day, our sitting, with those exercise snacks, it's going to help our overall health. And I do end up in my work, I end up sitting a lot. So I always have to find that time for that 30 to 60 minute workout at some point in my day. It just, like you say, it's part of my day, and I just figure out when to fit it in around a day that tends to be fairly sedentary with work. Not always, but I can really help, though, if I get up and purposefully take those breaks and contribute to my minutes. But I ultimately do, I also incorporate that specific workout because I have to counteract any sitting I do, and I think we all have to think about that. A lot of people are in jobs, though, where they're incredibly physically active, and that was another thing that we hope to be able to look at in the next guidelines is what is the effect of occupation? So there's what we call the occupational paradox, where if you are in these jobs that are incredibly intense in terms of your work, construction, for example, or where there's just a lot of physical demands, we tend to see an increased mortality in people in those positions, or an increased risk for chronic disease. So that's why we call it an occupational paradox. And why is that? Is it because they're not compensating outside of work? They don't do much recreational physical activity. There's some research showing that if you do more recreational physical activity outside of work, that you're better able to manage through those more physically demanding jobs. Or is it that that kind of hard work over the course of a lifetime takes its toll? And so we really need to study that more and understand. So, it's interesting. A lot of our surveillance systems are based on, they specifically ask your physical activity in your leisure time. So we're not capturing well enough the physical activity we do at work, the physical activity that we do to and from work. Maybe we're walking to and from work, and then household. So there's one surveillance system that does try to get to that. But for the most part, when we talk about how many minutes the average American is doing each day, it is based on what they're self-reporting in terms of their leisure time physical activity. We do not yet have a good enough picture of the 24-hour movement cycle for the average person. And We need to get a better, so we need to enhance our surveillance systems. I think the wearable devices are going to give us that opportunity to do that. We're going to collect more and more data, understand how people are moving through the day and how that impacts their health. And we have some real questions right now on, especially in the occupational and the work side of things.
That's such an interesting, would you call it the working paradox? Occupational paradox. That's so interesting, because I wonder if I often bridge the gap between mind, body, and spirit, and always say that they're all so interconnected, you can't separate. And I wonder if the fact that there's stress associated with this, or maybe that you don't want to be there, or you're doing an activity that is unpleasant, is different than doing an activity that's pleasant to some degree. And to do that for such a long time, because you think 8 hours of resentment is a long time. That could probably cause a heart attack more, which is, I guess, what,
I couldn't agree more, Anthony. There's so much to think about there and unpack there. That's why we really have to get into the literature and do more research in this space. Because it is the stress of our jobs. It also might be because they're constantly doing that job for 8 hours. Is it because they're not having enough of a rest or break during the course of that 8-hour day or more day, so that we have so much more to learn.
And variety. I wonder if that plays a piece. Overuse of the same thing.
You're right. And that could explain why, if you're doing more leisure time activity to build your strength and fitness and so forth, that maybe you can overcome or prevent some of those injuries. We have much more to learn.
Is it true that any bit for the average individual that goes from doing nothing to doing something? Because I know there's these minutes that we're supposed to meet, but let's say we're not meeting those minutes. Is it still beneficial to do something? From my understanding, it almost seems like anything more than what you did yesterday is better.
Thanks for asking that question, because you're absolutely right. The biggest effect we see on health and well-being with physical activity is from being sedentary to doing that next step of getting somewhat physically active. So we always say that, something is better than nothing, and more is better than, than something. So, but I would say that there's also a U-shaped curve there. We have to be careful. Another area of research right now is, we know that curve, as you said, is very steep when you first start doing some physical activity, and then as you get to that 300, it starts to level off, and then with extreme exercise that's high intensity, we start to see that U-shaped curve. So there's increasing evidence that ultra marathons, high intensity, endurance activity can actually be detrimental. Higher risk for atrial fibrillation, for example, or scarring in the cardiac tissue, or or other signs of where we're starting to really stress the body. So I think we have to also learn more about the excessive side of physical activity. But generally, for most adults, getting up into that 300-minute range is great. But to your point, a little bit is really, really important, and that's where we see the greatest health benefit.
So there is potential that there is too much.
Yes. Yeah.
There is potential for that.
Yeah. I was at the American College of Sports Medicine conference this last May, and many of the presentations were on that issue. It's one that we really have to get our arms around.
Yeah, and I often say that I think people can benefit from taking more of a recreational mindset. That are, especially New York City, because it's this, go-go or type A, or, got to be the best. You can't just run, you got to run a marathon, otherwise it's not cool enough. And you got to make sure your socks are, nowadays are a certain height. There's all the pieces. But I'm not knocking the marathon as a goal. No. I'm just saying, to go from doing nothing to then, and always having that mindset. It's also different if, other areas of your life, maybe you've calmed down. Like if you're trying to run a marathon and you got a new job and you're a new parent and at what point where are you in life, and is this the time for this goal? So I'm not knocking the marathon goal, but just the idea of some more a culture of recreation, that just to get out there a bit and, you know.
Well, also, Anthony, as you say, I think we have to give ourselves rest and recovery. You know, I mean, in any time where we're stressing ourselves, you know, in any aspect of our life, we do have to give ourselves the grace to give ourselves, and that's especially important in extreme exercise or harder physical activity. Give yourself time for rest and recovery. That's incredibly valuable, and in fact will improve your performance over time.
And correct me if I'm wrong, but I do believe that there would be forms of exercise that are more stressful and forms of exercise that are more stress relief. For example, and if you consider walking exercise, but going for a stroll, right, is probably more stress relief. Whereas maybe, you know, as opposed to, you know, going to the gym and doing a bunch of heavy lifts, I'm all for all of them, but meaning just the idea of having knowing which type of exercise does what, and, you know, using it at the right time.
Mm-hmm.
You know?
Well, we know from wearables and also from surveillance that walking is the most common activity that people use to get their physical activity each day. And so that's a great thing. It's immediately accessible for a lot of people, and it can be rolling as well. You know, if you are somebody with a disability and you're in a wheelchair, it can be walking, rolling, but it's very accessible in a wonderful way for people to start to meet the guidelines. Now, to your point, a stroll, like an easy walk, is probably stress relieving. It's a great way to get outside, get, you know, fresh air, and a great part of a healthy, you know, day. If you want to, you know, improve your cardiovascular health and fitness, you're probably going to have to do a more purposeful walk, you know, and increase your intensity and speed. But walking is a great modality for getting physical activity or rolling. Yeah, you're right. And that's why, like, as you say, variety is so important in your physical activity routine. You may walk one day, you may do yoga or Pilates where you're focusing on your flexibility and balance, you know, Tai Chi, or you might swim, or you might bike, you know. But we do know that if you mix it up and do different kinds of workouts, it tends to help you keep it a regular part of your routine.
Question about the components, and this kind of maybe leads into maybe the new iterations that are coming out. Right now I know there's aerobic, there's strength. I know in some of the paragraphs it did mention things like balance, although it's not highlighted as much. It like mentions it at some point. I used to have a friend, you know, colleague, friend, I admire him very much, but he would say, we both taught the Fitnessgram workshop together for New York City. And he would say, you know, one of the new things that happened was power, at least in human kinetics. They claim power as a component of health-related fitness and skill-related fitness, so it made the jump. And he said, you're going to see that eventually all of them will, because all of them are important. You can't, you know, agility, this, that, and whether you agree or not, you know, it's the idea that it seems like some of these other things are important too.
For sure.
Balance, agility, falls. Are there other components of fitness that are also important outside of aerobic and strength?
Absolutely. You know, flexibility, power is important to consider, but I think balance is where I'm spending a lot of time right now at the national level on policy change, because fall risk reduction, we're realizing falls are very expensive and unfortunate part of getting older. My mom took a fall yesterday, and so is recovering today. It's, boy, as people get older, falls become a really important thing to avoid. And so, you know, balance and flexibility are a really key part of reducing fall risk, building, you know, muscle strength. The whole, you know, every part of your fitness contributes to it. But it's, you know, the Centers for Medicare and Medicaid Services is looking at this very closely, because falls are very expensive for our Medicare program. And how can we reduce them? How can we help people live independently, safely? And exercise becomes an important part of that. So being able to cover supervised exercise interventions for older adults is critical toward helping them stay at home and avoid, and if we can do it in, deliver it in a group setting, another way to avoid social isolation and loneliness too. So I'm spending a lot of time on that now because this Centers for Medicare and Medicaid Services, this CMS agency and this administration are really focused on chronic disease treatment, but also prevention, which to me is a transformational shift. To pay for somebody to get supervised exercise intervention, not just for treating their diabetes or their hypertension or cancer treatment, but to prevent it would be an incredible investment for our country and our healthcare system. But in order for them to do that, we've got to show that that's actually cost saving. And so over at the Innovation Center, I really hope that they'll be continuing to test models of delivery where by delivering supervised exercise to people over 65, we actually end up saving money in the long term.
And will that be something that you think eventually will be applied for all ages?
Yes, I hope so.
Yeah.
Right, because what CMS does, generally other insurers follow. So that's why it's really advantageous to work with CMS as much as possible to get evidence-based strategies into healthcare delivery, because if CMS through the Innovation Center finds that it's cost saving, then you can imagine that other insurers are going to say, yeah, we probably should do this too. And some are already doing it. It's just that, to make it normative, to make it a standard of care is really critical.
Right. So people would be able to get maybe, for example, personal training prescribed by a doctor? Is that like what that would look like? So that's
where I'm spending all my time. So we haven't had a chance to talk about the Physical Activity Alliance yet. I don't know if this is a good time to do that. But, we brought the community together to speak with one voice. And that could be advocating for more physical education, comprehensive school physical activity programs. It could be some of the work we're doing in business industry sector. But right now, our major initiative is what we're calling It's Time to Move. And that's our effort to get physical activity assessed, prescribed, and then allow people to have a referral into the community for physical supervised exercise intervention. Not everybody needs a referral. A lot of people, once you talk to your clinician, can say, okay, on my own, I can start to exercise more, be more physically active. But some people need some help. And we know that supervised exercise intervention really has great promise because you're accountable to somebody for following through, and it can be tailored, and it can be part of a group delivery, in a setting with with others. That just has so many benefits all the way around. But there's a lot to address when you work on this. So just starting out, we had to standardize the measures for assessing for physical activity. So going back to our conversation, we had to stay in line with the physical activity guidelines. So hopefully when you go see your doctor or nurse practitioner or your clinician, they're going to ask you either before you come into the visit through a screening questionnaire or during the visit, how often are you exercising? How often are you physically active? Both for aerobic and muscle strengthening. We were able to get those questions into what's called an implementation guide that health systems and electronic health records use to exchange information and allow people to capture their health information. So we're hoping that health systems will pick up that implementation guide because then that standardizes it across the entire country. We're all asking the same question and getting the same information from people. And we're allowing for these devices, wearable devices, to sync with EHRs. You can provide your data through your wearable or just by reporting how much you're doing. And then it's up to the clinician to say, well, based on what you've told me, or we've got in here, maybe you do need to exercise a little bit more to be healthy, and are you ready to do that? And then if so, here are some options in the community that you could take advantage of. And what's been the roadblock is, can we pay for that? Can we, because we don't want finances to be a barrier for people to access those resources. So if it's a fall risk prevention program at your local Y, or a cancer treatment program, through the Medical Fitness Center, and we want to be able to create these opportunities for people to access those opportunities. And so that involves also, payment, we work with CMS, standardizing measures, and then aligning financial incentives. So the clinicians have to be incentivized to ask those questions. Just like in schools where it's a busy day, doctors have a very busy day, a very busy clinical visit, compressed time. They only have so much that they can talk to their patients about. Can we get physical activity in that conversation? We need to incentivize them to do that. So that involves measure development, quality measure development. So it gets really wonky really quickly, but we're trying to address each of these major systematic barriers that allow for it to become a part of standard of care.
And this is a part of the work with the Physical Activity Alliance?
Yes, which the American Heart Association's been helping to lead. And it's been exciting what we've been able to accomplish in a few years, but there's still a lot more work to do.
And so does the Physical Activity Alliance address many other community areas as well? Is that the big one right now?
Well, so we have, so that's our biggest initiative, but we have
Huge one.
It is a big one, yeah. We have what we call our CEO pledge. So this is creating a movement amongst corporate leaders, organizational leaders, just to role model and support physical activity as an important part of employee health and well-being. And so we want to, I want to give that a plug because, if you know any corporate leaders, organizational leaders that would be willing to sign that pledge, it's just a way to kind of build that movement. Because we know that if the leader of an organization is physically active themselves and provides the opportunity during the day for it, supports employees doing volunteer activity that involves physical activity, that can really contribute to the culture of a healthy culture of work. So we have that. We also do a congressional physical activity challenge every year with MyZone. So different members of Congress and their staff will join in this challenge for the month of May, and it gets very competitive. This year it got really competitive between Senate and House and Republicans and Democrats. It's a fun way for Congress to lead and role model the importance of physical activity. We are the home for the National Physical Activity Plan. So we work with the federal government to update the plan along with the physical activity guidelines across those 10 sectors. And then we have a memo of understanding with the Department of Health and Human Services to support the work of the federal government and help promote the physical activity guidelines. So we also do a report card actually, which you'd be very interested in on kids' physical activity. That's published every 2 years, and we coordinate with over 50 countries across the world to do that report card. So, that's unfortunately not a grade you'd want to bring home to your parents right now. Our kids need to be more physically active, but it's really important to kind of help make the case with school leaders or federal government, state governments, local governments that this is something we need to prioritize if our kids are going to be healthy.
Can we get superintendents and maybe the chancellor to sign it? Is that something that
would be fantastic. If we could do that,
let's see when at least one superintendent. We'll get maybe my superintendent there and there.
That would be amazing because
no pressure, but I'm gonna see what I got there.
I can share the link with you, Anthony,
Please
and that would be amazing. It's any leader like a superintendent, because your superintendent makes a big difference in the culture of your schools.
Absolutely. You're talking at least, let's say 45 schools. There's like 35,000 kids. Amazing. And that he has just under his umbrella. Yeah. So, you're that's a lot of lives. And then, the other superintendents see what others do.
I couldn't agree with you more.
And then they copy that stuff. So there's definitely superintendents I'm connected with that I know outside of through Shape America and different, which would be happy to sign it. But I'd love to see it in New York City, where our superintendents and our chancellor would be on board with that. Would be awesome.
Would be so excited if you could lead the way. That would be amazing. That would be amazing.
We'll see what I could do.
But you just made a really good point. It is really that kind of role modeling, that kind of policy or systems change can impact thousands and thousands of lives. And that's why I've been privileged to do this work because, at one point as I was working on my PhD, do I want to go in the clinical environment, which is so incredible, one-on-one, you work with patients to help them be healthy. What I get to work on is kind of a complement to that, where we're working on legislation, regulation, or public policy systems change that takes a long time sometimes and is really hard to do. But for instance, if you pass one comprehensive smoke-free air legislation in a state, you've right there affected thousands of lives where people aren't going to be exposed to secondhand smoke. You know, if we could improve comprehensive school physical activity, you know, across the country or state by state, you know, you impact thousands and thousands of kids' lives with that one piece of legislation, if it's implemented well, you know. So that is the other issue. You know, you can work on policy, but then it ultimately has to be put into place in a good way.
And for those superintendents that do tune in and listen, why is it important for them? Why do you think, why should they prioritize movement, you know, over maybe some of these other, and not even over other, but why should movement be prioritized?
Yeah, to me it's this best bet, you know, this, like we were talking about it earlier, where we know that it improves academic performance. We know that it reduces absenteeism. We know that it can help focus attention spans, in addition to helping our kids, our social and emotional well-being, you know, for our kids, helping them feel better, have better self-esteem, reduce anxiety and depression, which we know is a big issue in kids these days. So physical activity, exercise becomes one tool in your toolbox, but why would you want to leave that tool out? You know, I think it's just so incredibly valuable. It's just something you wouldn't want to miss.
And I think something I noticed with the new guidelines was that there was this emphasis on the brain a lot more. Whereas I feel like, I don't know, maybe 10 years ago, whatever it is, there might have been some, it wasn't fully confirmed maybe, or at a certain point where we'd say, oh, maybe it impacts academics, but maybe it doesn't yet. And I feel like now it's like, no, it is. Is that true, that transition happened?
There's been some amazing research done that actually with MRI and scans has shown that as kids exercise, you know, increased blood flow to the brain actually, and then you see it too, correlational research, so by association, test scores are improved and academic performance is improved. But there's actually a physiological or neurological underpinning to that, which is really exciting to see. Chuck Hillman, for example, has done a lot of that work. And so we do know that movement helps kids in any number of ways, you know, that's invaluable. And I will say that, you know, this administration, I don't know if you want to talk about the MAHA report,
let's jump into
but
it.
yeah, but, you know, so early in this administration, the president signed an executive order that said we're going to form a commission, the MAHA commission, and it was primarily secretaries, cabinet secretaries, and some political advisors. And you, within 180 days, you've got to 100 days, you've got to submit a report that, like, what are the big issues for kids, and then in 180 days, you've got to give me, you know, a strategic, the strategic leverage you're going to do to address those things. So we did get the first MAHA report, and, you know, healthy diet was emphasized, physical activity was emphasized, stress and anxiety that kids are feeling, environmental contaminants, and then over-medication. So those were the major areas of the report. So now you've got the next report has been submitted to the Office of Management and Budget to the White House, and it was leaked, you know, I think last week or a week before now, by an industry, you know, person who had access to it. So we have some idea of what's going to be in it. But, you know, this administration is really intent on addressing kids' physical fitness. And, you know, they've just signed an executive order not too long ago on reviving the President's Fitness Test, the President's Youth Fitness Program. We have some questions on how that's going to be done.
Yeah.
And I'd love to have your thoughts on this, but I think, you know, there was this transition with Shelley Full when she was the executive director during the Obama administration, where we went from the older national fitness test to the using FitnessGram from the Cooper Institute, where instead of kids comparing themselves against a national standard, they were comparing themselves in their own improvement over time and whether they fell into a healthy zone. And the feedback that she got during that, literally it was a tour of the country as they made that transition, was, wow, this is a great thing, because so many people, and you've seen it with the release of the executive order, feel like they were scarred with the way it used to be done. You know, like it turned me away from physical activity for a lifetime. Like that's tragic, right? We don't want to see that. Whether it was the rope climb or pull-up test, or, you know, like it was just, for some kids, it was just, and they just felt like, and they were in the middle of a class where they were compared to others, and, you know, they just felt left out. We don't want that. The last thing we want is for this to be something that turns kids away from physical activity. So doing it in the right way, empowering physical education teachers to administer the test, and, you know, against, you know, whether it's FitnessGram or a narrowed down part of FitnessGram. I think supporting physical education teachers is really critical. And then I think doing it fairly consistently, because we don't have a good enough capture of kids' physical fitness across the United States in our surveillance systems. Schools could be helping to collect those data if the fitness test is administered in a standard way. But I feel like it's the what, the how, that we really have to understand. And I hope it will be adequately resourced. You know, if the administration wants to see this happen, I hope schools will have resources to do it and do it well, and support physical education teachers. So we'll see. But it seems like this is an area of focus. I don't know where it's going to go, but we'll be closely coordinating with the federal government, staying in touch with how we can support as an organization outside of the government. And you know, it's the schools and physical education teachers on the ground who are going to be the difference in terms of this happening or not.
Question for you that I'm not even aware of, but so then would it replace the FitnessGram?
This has been my question, and we don't have a clear answer on that yet.
Right.
I will say that the Department of Health and Human Services had pulled together an expert advisory group over the last couple years to try to figure out potential ways for us to streamline FitnessGram, or have like core aspects of fitness testing and then maybe an optional list. And that was still being determined and finalized. And then this administration kind of decided it was going to take improving the program as a priority. So I don't know. We don't know yet where they're going to go.
Well, the fact that it's a priority, I guess, is a good thing.
I guess, you know, that's what we're hoping. Yeah. I mean, fundamentally, that is a good thing. Well, fundamentally, it's exciting to see an emphasis on kids' physical activity and fitness as an important part of their overall health and well-being.
Just hopefully it doesn't go back to the way it was done in the past, I guess.
Exactly
is the big
right.
thing.
That's exactly right.
Yeah, which is beyond essential. Like I'm seeing, you know, on the ground and being with phys ed, part of my job is I conduct the professional learning for the phys ed teachers in the district. So I'm with 50 to 100 PE teachers. They tell me everything. You know, it's beyond essential. In fact, if you went back to just doing it, you know, the old way, you would be doing more harm than good. I guess that's the worry. Or
that would be the high-level takeaway that I couldn't agree with you more.
Right. So yeah, wow, we hit on a lot of good stuff here. Are there any other big hitters in regard to bringing physical activity to life in the community? I know we said work, we did, you know, schools a little bit, we did, you know, are there any other big hitters that we might have missed?
Yeah, you know, the Centers for Disease Control and Prevention has an initiative called Active People, Healthy Nation. And they're really helping to fund states and local communities in supportive environments for physical activity, and really where we have so much evidence is on active transportation infrastructure. So the ability for people to walk, roll, you know, bike safely in their community means adequate sidewalks or complete streets policies where streets are designed for everybody, not just for cars. The ability to access public transportation in urban centers, in rural environments, having parks and recreational spaces. So that infrastructure is really, and you know, recreational parks and recreational centers are important everywhere. But we do have to think about our rural settings as well as our suburban and urban settings as we discuss, you know, the infrastructure. But as you say, you know, supporting people in physical activity takes you know, a focus on so many different environments and sectors, but the community sector and active transportation opportunities, recreational opportunities, making those possible safely is a key part of our work.
Yeah, I say that one is tremendous also. If you think the exercise snacking piece, right, that you're able to walk or take a train, or it really just puts that, if you have to force it, it's a lot harder. If it's just there, the staircase is right there, or the park, it's the bike, the city bikes, the this, the that, little, when it's there, I think it's much easier to do.
That's right, and it makes it more normative for people to do too. Like, people just see others doing it, or see people where that's the choice I'm going to make, and then other people see that, and so, yeah, it's a collective effort, but
I would love to see more kids in parks too.
Me too.
And I've always had like little ideas here and there, but I'm like, I wonder, because parents will say, oh, maybe it's not safe, it's not this. I'm like, do I have like a phys ed person who lives in the neighborhood, like wear a T-shirt that says like, I don't know, I'm an advocate or something, that they feel safer to be in the park because they see the yellow shirt, or I don't know, something like that, or there's a shirt or something you wear, or a pin that's like, I'm a part of this community, like we, and, yeah.
Anthony, it's so true that I think we all can play that role of advocate in our community. Walk with a Doc is a wonderful program, and it came about for, with that idea that a physician could, in his or her community, lead a group of people each week on a walk, on a physical activity, right? And what a powerful, and then it becomes educational at the same time, and it's a group session, people look forward to it, and I just can't say enough about that. It's a great program, and there are so many programs like it, Girls on the Run, et cetera, where individual advocacy ambassadors in a community are making that difference. They're enabling kids to move, to be physically active in parks or in recreational sports after school. Parents are volunteering time to allow that to happen. A physician takes the time once a week to walk with his or her patients. It's incredible how individuals can make a huge impact. So there's this local community change that we can all take ownership of, and then there's the other, policy and systems change work we need to do.
Yeah, and you need, I think, local heroes.
Absolutely.
And because it's not going to happen, it has to be convenient, otherwise it don't work. So it has to be local. Your local park is a gym, and all those things,
I totally agree with you.
Man, yeah, we hit on a lot of good stuff. I think for me, one of the biggest things is the motivation behind some of this, which I love the new research that's coming out. I love the guidance that's coming out. I love that it mentions things like the impact on the brain, because if we're so, why are you sitting in a chair anyway? To learn, to this, to that. Well, physical activity is going to help that. I think when people make the connection of how physical activity will impact all these other areas and how it's impacting, like, do you know that physical activity is, directly or indirectly tied to anxiety? Why are you feeling so anxious right now? Going for a walk, what happens in the body, knowing a little bit more of the specifics. But the research is moving in that direction. I think the policy is following behind it, and people are starting to see more and more. It's not just about looking fit and preserving the body. Right. It's about this holistic, it's impacting every single part of you, mind, body, and spirit. And so I see the trends going in that direction, and eventually, there's always a delay into what you can see in the world, but eventually I think we'll start to see, even in my neighborhood, I see more bike lanes. I see a little bit more of like recreational sports. You kind of have to maybe go to a different park to get it. Eventually we'll have it in every park, but it's slowly, moving in that direction, and inspiring people and helping people to know how this is impacting them in many different ways is, I think, a big part. So hopefully people tune in. And
well, thank you so much. This has been great. I couldn't agree with you more.
Yeah, thank you for today. And all these questions, I feel like I had so many more. We're already like an hour in, but we'll leave it at that for today. Maybe we'll do a part 2 sometime, and I appreciate you.
I'd love that. That'd be great. Thank you so much, Anthony.